So I'm Steve Cox. I'm a physician assistant, independent physician assistant here in Utah. There's a handful of states that allow for independent physician assistants, like nurse practitioners, to practice independently. That's what I do in Utah. I'm also licensed in Hawaii and Idaho. My background really is in orthopedics. So my specialties in orthopedics, injections, and regenerative medicine. And so I got right into orthopedic surgery out of PA school. I did that for almost a decade in Washington State, about 6.5 years in Washington State, and another 3.5 years here in Utah. And orthopedic surgery is great. I mean, I miss it sometimes, but it's pretty hectic, a little stressful. So I had to get out of that at some point. But that's where I started using regenerative medicine, was with a surgeon that I was working with here in Cottonwood Heights. We were using stem cells and regenerative medicine on our D1 and professional athletes that we were doing surgery on, because they need to get back to playing, right? Instead of a 6 to 9 month recovery on an ACL, we could get them back in like 4 months. With stem cells afterwards. And so we were using that. It was working great. We started using regenerative medicine and stem cells for some of our patients that were not good candidates for surgery, or for some reason they didn't want surgery. We said, well, okay, we can put some stem cells in there and it'll help. And it did help. It helped a lot, actually, more than we expected. So I eventually got out of orthopedic surgery and started doing regenerative medicine full time with stem cells, PRP, ozone injections, things like that, IVs, trying to just keep people healthy, try to keep them out of the operating suite if I can. Well, stem cells have been around for a long time, back since the 70s, 80s. I mean, they coined this term stem cells, and they said these are cells that can reproduce and they can create new tissue, and maybe we can even clone things with them, and that didn't work out so well because they were using the embryonic stem cells for that. And the embryonic stem cells are very aggressive. They multiply like crazy, and they're meant to kind of form a specific substance, or a baby, for instance. And so the FDA came out and said, we're not going to use embryonic stem cells except for research purposes. The studies on stem cells for cancer, for some of these incurable diseases, has been going on for decades and decades. About probably 20 years ago, the breakthrough was made that there's this certain type of stem cell called mesenchymal stem cells, or adult somatic cells, that are safe. They don't multiply and become tumors like embryonic stem cells. They limit themselves to just becoming new tissue. That's when we started using the products kind of that we use today, from the umbilical cord and placental tissue. I mean, you can also take it from yourself. You can take it from your bone marrow or from the fat cells. I don't think that's the best option, but you can. And these cells are safe. They secrete exosomes, and the exosomes are like the hard workers of the regeneration, world. And they go around and tell your body kind of what to do and what to fix. And the stem cells are also there reproducing and making new cells and creating new exosomes. That starts this mechanism, a whole cascade of healing that lasts for quite a while, actually. It's not a cure, and it doesn't last forever, but it helps. And it can help in certain situations, like people with osteoarthritis, who maybe are not good surgical candidates for total knee replacement. It can definitely help with musculoskeletal issues like torn meniscus, torn rotator cuff, torn tendons, things like that, a tennis elbow. These respond very, very well to stem cells because it's a explosion of healing in the area. And so then we try to find ways to adapt that to what's going on with everybody, try to keep them healthy, and then support the stem cells with alternatives, ozone and PRP, platelet-rich plasma, red light, vibration, electric stim, acupuncture, things like that. These are all good things that I think fall into the functional medicine, alternative medicine world that can help improve health overall. And stem cells, I think, are a big key to actually regenerating some of the damaged tissue. I think stem cells can be applied in almost every situation where we have degeneration, where we have damage, injury, that kind of thing. The number one thing I usually inject stem cells into is the knee for osteoarthritis. I get a lot of patients who come in with knee osteoarthritis, sometimes bone on bone, and they don't want to have surgery. A knee replacement is a good surgery. It's a very good surgery. It can extend life and make people more active again. But it's not 100%, just like everything else, it's not 100%. And what I found in my experience in my orthopedic practice was that about somewhere between 40 to 45% of my patients who had total knees were not happy with their total knee. It still swelled up. It still hurt. They can't kneel on it. They still couldn't do what they wanted to do. And I even had, quite a few patients come back and say, Steve, I wish I'd never had this done. Another telltale sign is they'll get one knee done, and then you say, okay, you want to do the other knee? And they say, nope, I'm good. And so then they start looking for other options available for the other knee because they don't want to go through that again. And that's where I have them come in to my regenerative clinic and say, yeah, we can put stem cells in there. With a knee, the success rate with stem cells as far as decreasing pain, improving function, and making them happy is about 90%. And so 9 out of 10 people are happy they had the stem cells done and they didn't need surgery. The real proof is in the pudding, right? They're moving better. So when they come in, I watch how they're walking and I say, yeah, you're walking better. And they say, yeah, oh yeah, my wife told me or my spouse told me, hey, you're not limping anymore. I'm like, yeah, that's exactly what the stem cells do. And so they have a super anti-inflammatory effect. And then, of course, they reproduce, regenerate, secrete exosomes. They do have the capacity to make some new tissue, but they're not going to make like a whole new meniscus. Just injecting stem cells into your knee is not going to fix the meniscus that you had taken out when you had surgery. Me too. I had the same knee surgery. But what they do is they can decrease the inflammation and stop the inflammation cycle while the exosomes are communicating with your body saying, hey, this is an area that we need to kind of heal and focus on. And so it gets increased healing. The inflammation is down, so the pain is down. You can sometimes get a small layer of what's called pseudo tissue or pseudo cartilage that the stem cells will create, but it's usually not a whole lot. But I tell patients, it's enough so that you feel better, and you can move better, and you can still do the things you want to do. Backs are tough because there's so much variability, so much movement of the back, so many little facet joints, and you have this very important thing called the spinal cord that runs right down the middle that you don't want to mess with. There's also root nerves that come out on the sides that you don't really want to mess with either. And so then it's a fine line of using imaging to try to get the stem cells down as deep as I can get them to where the damage is. I try not to get too close to the root nerves because that can cause pain, but what I've found is that with backs, where knees are like 90% successful rate, backs are about 80%. There seems to be about 20% with the backs that just don't quite get the result that they're looking for. But they're better. They're usually better. But again, I use ultrasound imaging to make sure that that's nice and safe kind of thing. And so after that, it's a mixture of shoulders, ankles, scalp, face, toes, fingers, hands, IVs. Some people come in and they say, I have type 2 diabetes. I'm working on losing weight. I'm changing my diet. But can the stem cells help my body on the inside heal? And can my pancreas get better? Can I become more sensitive to insulin? And we've seen that, yes, you can. When we infuse stem cells into the body, they home to areas of inflammation and damage, and they migrate to those areas and begin the healing process, again, secreting messaging cells called chemokines and cytokines and exosomes to tell the body, hey, incorporate your own stem cells as well to this area so we can get advanced healing. And I have seen A1Cs come down with nothing more than just stem cells and diet and exercise. I think everybody has their different protocols and what they like to use. What I've found over the years is it really depends on the amount of damage. And so if it's just a pretty typical medial compartment osteoarthritic knee with, knee or bone on bone, I think 1 unit or 1 cc or 1 milliliter of stem cells into that knee is perfectly good. I think that's a good amount. And then I'll usually support that with follow-up PRP and ozone injections. And then, have them rest it, work on motion, stretching. If there's any kind of stiffness, we got to try to work that out. Stiffness causes pain. I think that's fine for a large joint like that, 1 or 2 units. If it was a really damaged knee, like previous ACL reconstruction, multiple surgeries, lots of meniscus tears, I might consider putting 2 units in, but targeting specific areas. 1 kind of going in, just hitting everything, and then 1 maybe if they're like, yeah, I want you to hit my ACL, and then I might use the ultrasound and try to hit the ACL as well and a little bit of the meniscus in that area just to be sure. But typically for a large joint, 1 or 2 cc's is fine. For a medium joint, I would go with half cc or 1 cc. And for a small joint, whatever you can get in. For the backs, it's a little bit different. Usually I tell patients that I can usually cover about 1 or 2 levels of the back with 1 cc. And so most common area that gets damaged is L5S1, L4, L5, and L5S1. And so they'll come in, and if it's just L5S1, 1 unit's fine. If they're L4, L5, and S1, I might do 1.5 units or maybe in 2 units. But each level you kind of add on, you have to think there will be some migration, kind of one level up, one level down of these regenerative tissues. And in the neck, they're all kind of squeezed together like this. So I don't need quite as much in the neck, but in the lumbar spine, if I'm doing like the whole lumbar spine, it's probably more like 3 units or 3 cc's that I'll dilute with a little bit of normal saline and then inject kind of at maybe L1, L2, L3, L4, L5S1, kind of like that. And that way I know I'll get migration throughout the entire lumbar spine. And then maybe even the SI joints too. It just depends on how much damage there is, really. I'm not a big fan of what we call the treat and street, which is we'll do 1 injection, send you out the door, see you later, hope it goes well. What we've seen with the studies, what we've seen in clinical experience is that follow-up makes the stem cells work better. And patients are happier when we follow up with them and support the stem cells. Plus, we have all these other lovely modalities that we can use. So I think we really do a disservice if we don't follow up. And my typical program, like a stem cell program, lasts about a year, really. What the studies have shown is that this kind of mechanism or cascade of mechanisms that happens with the exosomes, the stem cells, and the signaling cells can have a lasting effect over about 9 months, even sometimes to a year. And so I have some patients that I'll inject them and then I'll follow up with them. And I always tell them, usually I see a result within the first month, okay? Sometimes even the next week, but not always. I have had patients where it's been 2 months, 3 months, 4 months, even 6 months, and they're like, I still haven't seen any difference. And so I follow them because I do get the patients at the 6-month or 7-month mark who say, I think it's starting to work now. You know, I'm feeling better. I'm moving better. And I'm like, sometimes it takes that long for that inflammation cycle to stop, you know, and get all the inflammation out before the actual healing can begin. Plus, if they don't necessarily follow the protocol that I've given them, we could have ongoing inflammation that's just kind of canceling out the healing. And so occasionally it takes that long. So I follow them for about 9 months to a year. Sometimes monthly, sometimes every other month treatments with platelet-rich plasma into the same affected area. Ozone therapy, it's pro-inflammatory. It's going to cause a pro-inflammatory reaction right when you inject it. If their reaction is pain, right away I know that area is still inflamed, because it's like having a bruise and just poking a bruise, right? It hurts. Now, that's why I usually wait for the ozone until about a month, 3 or 4 weeks after I do the stem cell injection, because I want things to calm down. And then I can see at the month, okay, how calmed down are we? If they're still having a lot of pain, okay, we're still inflamed. We really need to kind of back off if maybe we're doing a little too much. If I put the ozone in, they go, I don't really feel anything. You know, it just feels like it's expanding. Great. That's perfect. The inflammation is down. The stem cells are doing their job. Now that ozone is going to turn back into oxygen really quickly, and we're going to have hyperoxygenation of the whole area like a hyperbaric chamber. And what does the body love? Oxygen. Pre-stem cell procedure, you usually try to have them just decrease the inflammation or the injury or the damage as much as they can. Sometimes there's not a whole lot they can do. Try to get them on a anti-inflammatory diet, like a Mediterranean type diet, you know, and stay away from sugar and alcohol. And then I don't want them to take anti-inflammatories. Anti-inflammatories like ibuprofen, Aleve have been shown to be kind of detrimental to this cascade of mechanisms that happens with the stem cells and the exosomes. And so we try to keep them off the NSAIDs. Just be prepared that it takes time. Sometimes it takes time. Sometimes it doesn't. Sometimes they come back the following week and they say, I'm already feeling a difference. I feel great. And that's awesome. And some of that might be mindset, but I think some of it is the actual, you know, product most of the time that helps. And so I tell them, have a healthy mindset, an open mind. This is probably going to take a little bit of time, but don't worry, we're going to see you and follow you throughout this whole thing, and we have a lot of different things we can try if things aren't going quite like the way you want it. I think a lot of the protocol or a program or you know, the minutia comes with just experience in doing it. right? And so what I found is most of the time with stem cells, you want to use a little bit bigger of a gauge, but fairly normal gauge, like a 22 gauge needle, 1.5 inch for a shoulder joint, a knee joint. That's a pretty typical normal size gauge needle for any kind of injection into those joints. For a hip joint, depending on which way you access it, because you can access the hip from the side, from the front, you could even try to go from the back, but I typically use a longer needle for those because it's a little bit deeper, so like a 3.5-inch spinal needle, 22 gauge again. The hip is where imaging, like ultrasound imaging, really helps out, because what you don't want to be doing is fishing around in somebody's hip or groin area trying to find the joint. There's a lot of important stuff around that area that you don't want to be poking. And so for hips, I'll use longer 3.5-inch spinal needles. For knees and shoulders, I'll use just a 22 gauge 1.5-inch needle. For base of the thumbs, I'll use like a 25 or a 22 gauge, but like a 1/2 inch, because you don't need a whole 1.5 inch to go all the way through here. The back, lumbar spine, you have to use a spinal needle. You can't get down to the areas where you need to without a spinal needle. You just can't. And again, that's where imaging comes in handy as well, just to be safe. Necks and thoracic, I find just a 22 gauge 1.5 inch needle is perfect. And make sure you know what you're looking at and do your physical examination and find your landmarks, technique to make sure you're safe. The only time I would really do an intermuscular is if there was actual damage to the muscle. And so sometimes I get patients that come in with a torn quad tendon or a torn quad itself or a hamstring tear or something. I think it's beneficial to put the stem cells or anything that you're going to use for regenerative or healing right at the area of damage. And so if it's a joint, I'm going to put it in the joint. If it's a muscle, I'm going to put it in the muscle. If it's a tendon, I'm going to put it right at that tendon, right where the tear is, kind of thing. And so intramuscular around an area, I think, could be used for somebody who is not familiar with intra-articular injections. And you'll still get some benefit because there is migration of these tissues, right, of these cells. They do migrate to areas of damage, and you will get some benefit. But in my opinion, I think it's better to put it right in the joint or right at the area of damage. IV is great. We have really become a society now that's starting to pick up this IV trend of, hey, we can do vitamins IV, we can do medications IV, we can do stem cells IV, right? What happens if we do stem cells IV? Well, they're going to go in the bloodstream, they go right to the heart, from the heart to the lungs, then back to the heart, then out to the body. And so I have treated quite a few people with lung disease, heart disease, and other systemic autoimmune diseases like MS and rheumatoid arthritis with IV stem cells, diabetes with IV stem cells. I think it's definitely beneficial. We know from the studies that the stem cells seek out areas of damage and inflammation and migrate to those areas because we've done follow-up testing with marked cells. I never know exactly where they're going to go. Some of them will go up to the brain, not a lot. There's a blood-brain barrier that kind of blocks some big molecules and particles from getting up there. Generally, it's going to go throughout the whole body, and they will home to areas of damage and inflammation. So what does that mean? Well, for my rheumatoid patients where everything hurts, I say, well, it's not really feasible to inject every single, digit and every single joint on your hand, on your legs. Let's put it IV, and we can focus on some specific areas that are hurting. But usually they get this kind of systemic anti-inflammatory benefit where they just overall feel better. And that's pretty typical of IV stem cells. Of course, you could pair it with IV vitamins and Myers cocktails and things like that, IV blood ozone. Again, for things like diabetes, rheumatoid arthritis, multiple sclerosis, a lot of these autoimmune diseases that don't really have a good cure or a good treatment even, I think IV stem cells are great. And what I would typically do is do 2 units of stem cells, so 2 cc's of stem cells IV, and just do kind of a slow push, or you could even do a drip if you wanted. And most people do great. They love it. My philosophy with injections has always been do the injection as quick and painless as possible, but be efficient and effective. Don't be so quick that you're making mistakes and that you don't get the medication where it needs to be, but be quick that you're getting it where it needs to go, but you're not spending time in somebody's body with a needle poking around. That's when things kind of go bad. Really, it's about knowing your anatomy, knowing good technique, and being confident. What I find with like IVs, I usually do a slow push of the stem cells over about 5 minutes with IVs. And what I'll do is I'll just, I'll put an IV in and just hook up the stem cells with some diluted NS, and I'll just sit there and talk to them while I'm slowly pushing the stem cells in. What we find is that if you push them all in, the patient gets a little bit kind of like a weird rush, and they don't like that because they're like, whoa, what was that? Also, stem cells and these regenerative cells tend to be a little bit sticky. They'll kind of stick together and stay together. And we don't want them to stay together. I want kind of like a sprinkler effect where it's kind of like just kind of going in a little bit by a little bit so that it's kind of going throughout the entire system. And so that's why I like that procedure that way, just a very slow push over about 5 minutes with IVs. With injections, it just depends on how quickly you can get the medication in, causing the least amount of pain and discomfort. Some patients, like in a knee, they want me to just go and put the needle in, push it in, and be out real quick. Other patients, I've found that if I do that, it sets them off and they have a pro-inflammatory reaction. So I have to go in and just be kind of slow, not move the needle around, but just kind of slow push and then come on out. And so it really just depends on the patient. It depends on your experience, what they're able to tolerate, and how good you are with your injections. It's always been kind of a gray area with alternative medicines, especially ones that are FDA allowed but not FDA approved. And that's kind of the key, is that I tell people these are FDA allowed products like supplements. They're monitored, but they're not approved like a drug. And they didn't go through that approval process like a drug to treat a specific or cure a specific disease process. However, stem cells have gotten a lot of scrutiny, especially over the last 5 years, because the word is getting out, right? It's been getting out. 10 years ago, it was kind of like the wild, wild west, where it was like, we have these stem cells and we can do anything with them, And the FDA kind of was aware of it, and they were a little bit worried about it, and they kind of clamped down, and they said, no, we can't use these specific types of cells, first of all. Second, if you're going to be doing the procedure in clinic, you have to, do this and have the procedure and use sterile technique. And if you're going to be using stem cells from the umbilical cord placenta, they have to come from a lab that's FDA approved. So the FDA has to actually go on site to that lab, and that lab has to pass an on-site inspection saying, yeah, this is up to code and safe. Well, back in 2022, the FDA did this and clamped down, and a lot of the labs in the country were shut down because they weren't up to code and up to regulation. And again, I was saying it was kind of like the wild, wild west, where all of these stem cell clinics and stem cell labs were popping up like crazy. And the FDA said, no, we got to regulate this a little bit more. And I agree with them, because there was some things that happened that were not good. And if people misuse the stem cells, or they're marketing them a certain way, or saying that they're stem cells or live cells and they're not, or taking cells and putting them places where they shouldn't put them, bad things can happen, okay? And so I think the FDA was right in doing that. Back in 2022, we're in the place where there's not a whole lot of labs out there now, because a lot of them got shut down, but the ones that were still open had a really good product. And so we were able to use those labs and really build on, okay, we still can't market these a certain way, but we know they help, we're going to help people. And now we've kind of really hit the ground running in 2024 with the FDA now relaxing the regulations on stem cells, because the labs are up to code now, and they've cracked down on the providers saying, you guys need to know what you're doing, and you can't be screwing around with this stuff and hurting people. And so now we're reaching our stride, I think, where regenerative medicine, stem cells they're out there, people know about them. It's still a little bit of a taboo subject because we're not taught about these things in medical school. It's things of the future that maybe one day they might be available and they might help. But that day is today. The studies are out there. I mean, there's ongoing studies right now for things like Alzheimer's disease and heart disease. What's the number one killer in the States? Heart disease. If we can help people get healthier and heart healthier, we can save a lot of people's lives, and that kind of thing. So there's a lot of more studies going on with these mesenchymal type stem cells, these adult somatic stem cells that are safe. We're able to actually market them a little bit more now, thanks to the FDA relaxing the regulations. But again, we still have to stress that these are FDA allowed, not FDA approved. And I go into detail a lot of that in usually my presentations. But basically, We get our stem cells from an FDA approved lab, and then we make sure we know what we're doing and use proper technique, and we can help a lot of people. I think it can be good and bad. I think there are other places in the world that are doing a lot of really good research and a lot of good things with stem cells. Philippines has a lot of studies. China has a lot of studies. You can go down to Panama and get IV stem cells there. And I think it's good. On the flip side, could it also be dangerous? Yes, it can, because these countries do not have a regulating body like the FDA that says this has to be a FDA approved lab and we can only get the stem cells in this, harvesting the stem cells in this specific way, and it has to be clean and it has to be safe. I mean, there are stories of people going down to Mexico getting who knows what and not coming back, and that's scary. Yeah, you might save some money, but again, there's no regulation on any of that stuff down there. Would I do it? No. Would I stay here in the States? Yes, definitely. There are labs all over the country that are now FDA approved labs where you can get umbilical cord, placenta, tissue, stem cells, regenerative cells that are safe to use, and there's no problems with that. You can also go to a clinic or see a doctor who does the in-clinic procedure to harvest your own stem cells from your bone or your fat. Again, I don't think that's the best option, but you can do it, and that's safe as long as the provider is knowledgeable and using correct technique and safe practices. I tell everybody, because people tell me, oh, I was thinking about going down to Mexico to get stem cells, and I don't do that. Don't do that. Come to my clinic. I will make sure that you get a safe product that works.